First off, we want to welcome everybody. You are joining us for the Ready by 5 Millage Technical Assistance. Today's topic will be about milestone and outcome payments. As many of you recall from the orientation, milestone and outcome payments are a concept that we are introducing with the latest round of services that were funded by Ready by 5 Millage funding, specifically with the home visiting, healthy development, and healthy and safe home services. So we'll see if we can get my screen to go here. And here it goes. Okay, well, welcome. As we mentioned before, we'd like to take a moment and introduce our speakers today. We are fortunate, in addition to a few of our Ready by 5 staff members, we have some guests from Social Finance, the organization that we have been working with that has been helping us set up this payment structure. So we'll go through and do introductions. Let's start with the Ready by 5 team. First off, we'll start with Tyler. Do you mind saying hello and giving a brief introduction of yourself?
Yeah, I think I can. Hi, everybody. It's Tyler Amon. As most of you know me, I'm the data and outcomes analyst with First Steps, and I work on the Ready by 5 Millage. So I'll be talking through some of the data portions of this milestone and outcomes payment piece. So I'll be talking a little bit later.
Great, thanks, Tyler. And we have Kati Cortez. Are you there, Kati? You want to say hello?
Yes, I'm here. Hi, everybody. This is Kathy Cortez. I'm the financial accountant. I met most of you, and I will be talking about the invoice process.
Thank you, Kati. And our social finance team. Do you guys mind jumping in, introducing yourself, and perhaps giving a quick introduction to social finance as well?
Sure. Hi, everyone. My name is Hamali Bashiam. I'm also joined by my colleagues Thomas, Cohen, and Danielle, who are also on the line and you'll be hearing from soon. So I'm an associate director at Social Finance in our Boston office, and I'll give you a quick brief overview of Social Finance. We are a national nonprofit that specializes in pay for success financing, ranging from, you may have heard of social impact funds, all the way to outcomes rate cards and other sort of private sector work that we do. The primary intention of our work is to help link payments to outcomes and really drive incentives and making sure that we're all aligned towards those same outcomes. But we're excited to be working with you all and look forward to answering any questions. Danielle and Thomas, do you guys want to just give a quick introduction of yourself?
Sure. Hi, this is Thomas. Hi, this is Thomas Cohen. Oh, sorry, Danielle. This is Thomas, and at Social Finance, I focus on work related to data systems, performance management, and evaluation, and just working with Hamali and Danielle on this project, and it's great to be here.
Hi, this is Danielle. I'm the senior associate in the Boston office at Social Finance. Excited to chat today.
Thanks all. We appreciate you being a part of this. Just a quick note about technology. We have everybody's lines muted for the presentation. Once we get through the slides, we will open it up for questions, and you will see that you will be unmuted and able to ask questions at the end of the presentation. So please note your questions as we go along, and we'll be sure to get to them at the end of the presentation. So continuing, we Thought we would do a quick introduction of what the outcomes rate card is, and we'll have our social finance team kind of jump in here and give a quick overview here.
Great, I can do that. So as I mentioned previously, outcomes rate cards are one of many tools across the Pay for Success spectrum, ranging from outcomes rate cards all the way to social impact bonds, where you actually have external investors who are providing upfront financing. In the case of outcomes rate cards, traditionally what happens is, we have sort of the fee-for-service output contingent contracts that are in place for most types of contracts that are happening. With outcomes-based rate cards, payments are contingent on some sort of outcomes achievement, and it ranges from partial all the way up to 100%. In our case, what we've done is, we have sort of bonus payments on top of for the first year, and then we've also outlined some contingency depending on the optionality that's there if providers choose the option to have some sort of contingency with a higher bonus on the outcome. And outcome rate card are a really great tool to achieve the specified outcomes that we're looking to achieve based on the value of the specific outcomes that we've outlined. And those prices are often set based on a pretty thorough literature review and evidence-based of looking at specific outcomes, the cost of addressing those outcomes, and the value to society for preventing, specific certain social outcomes related to a lot of the issues that you're all tackling. So we're excited to be using this outcomes rate card as a tool to help align the community towards a more outcomes-based approach, and excited to work with you all to help make that possible and make it as easy for you as possible as well.
Thank you for that. And taking that level, that high level, and bringing it to the local level, here in Kent County, the reasons why we want to adopt this outcome rate card. In this funding, we want to support activities where all service providers are moving towards similar goals, moving the needle in specific activities. And we had shared this during the orientations that we've had with each of your organizations, but just to kind of bring your attention back to the why. What we want to see that we're ensuring services are reaching and successfully engaging our most vulnerable families. We want to increase the frequency in which young children are screened to identify developmental concerns early. We want to support healthy births. We want to increase the frequency of which young children are screened for lead poisoning, especially in areas where lead poisoning is unfortunately common in this community. We want to ensure that all children who are identified having a high lead level receive supports and evidence-based interventions to remove environmental and health risks. We want to see increased completion of all well child visits, and we are using immunizations as a proxy measure for this for now. We would like to eliminate and address barriers to access and utilization of services that families are referred to. We talked about how in services, there's oftentimes not a common definition of referral. And we want to make sure that within Ready by 5 services, all service providers are using the word referral, meaning that families are fully connected to services and that the service provider or agency providing the referral is ensuring that all the barriers are removed and families actually do get connected with the services that they need. And finally, we want to show programs' impact and effectiveness with parent education and support. So we'll get into how we are going to measure each of those throughout the different programs. But just a quick overview here too. And again, this will probably look familiar as you will see this language in your provider agreements that you are currently putting in place with First Steps Kent. There are the fee for service dollars. So this is the unit rate that you included in your proposal and that we have included in your statement of work. The rate that you will be paid for the services that your agency provides. In addition, if your agency is successful in accomplishing the activities that we have defined that move all programs towards the goals that we just outlined in that previous slide, we are calling them milestones and outcomes. If your agency is successful in accomplishing the activities around that milestone, you will be eligible for a milestone payment. These are maybe a little more short term in terms of accomplishing a certain activity, and we'll get into the specifics here soon. You're eligible for these today. So the way that we've set up data, if you are submitting data as we have prescribed, you should be sending us information that is showing that you are accomplishing those. The outcome payments we've graded out. We're not going to get into those today, but we wanted to remind everybody that in year 2, there is an opportunity for additional payments related to these outcome metrics. We will touch on those today, and we will continue to put out additional information throughout the year as your agency needs to decide if that's something they want to participate in during year 2, and we'll have the opportunity to confirm that they want to participate in those payments later on this year. So we're going to start getting into the details around the data collection, and I'm going to kick it over to Tyler to walk us through all of those additional pieces.
Right. Yeah, so we're going to talk a little bit about data. I'm going to go through some other pieces as well. I'm going to go through a little bit of Exhibit E, just to generally talk through one of the pieces that we're going to highlight today. We're going to go through an example, which I have added to the data submission template that you all got previously. And then I'll kind of talk a little bit about how the reporting piece is going to go. So for right now, I want to start by talking through one of the pieces that is in our Exhibit E that you guys had in your contracts, particularly related to ASQ screenings, which would be for the Healthy Development Home Visiting Group. So Heather, if you could pull up Exhibit E real quick for me, and then I can kind of talk through that piece. So I'm not going to go through this in depth. We ask that you guys try to read through this exhibit as much as possible and as thoroughly as possible, because there's a lot of good info as it relates to both the outcomes and the milestone payments. So for right now, I'm going to talk to you guys specifically about the milestone payment for the ASQ as kind of an example, and then we'll go from there. And just so you all know, we'll probably go more through this in depth as well in our quality improvement consortium meetings for each of the groups. So in the home visiting group, the healthy development group, and then also the healthy and safe homes group, we'll go through the particular milestone payments, and then we'll probably touch a little bit on the outcome payments, but we'll go through those more thoroughly in year 2. So for the ASQ screenings piece, essentially I want to talk about that piece as it's defined in this contract, and then we'll go through the example and go through kind of the data submission template piece of this. So when it comes to ASQ screenings, there's 2 of them. There's the ASQ3 and the ASQ2 or SE2. So developmental screening rate of 1 ASQ3 and 1 ASQ SE2 for children at or through age 5 up to a maximum based on the child's age, and we'll talk about that a little bit more as we go through this. So in order to be eligible to receive any bonus amount for this metric, a provider must complete at least 1 ASQ3 and ASQ SE2 for the enrolled child at or through the age of 5, and FSK reserves the right to not pay the bonus for multiple screens completed if the screens were completed were not in accordance with the recommended intervals. This is just so we don't have, 6 ASQs in a year, for example, when it might not be entirely the necessary piece. But we're just going to kind of talk through that. So we'll go back to the slides real quick, and then I'll kind of go through the example. But just as a reminder, try to read through all of these for all the different milestone payments that are available, and make sure that they're kind of applicable to the programs that you guys have set up already, and go through from there and figure out exactly what pieces kind of align with the work that you're already doing. So if we go to the next slide, there'll be pieces that we kind of already touched on with the ASQ, but I want to kind of highlight some pieces in there as well. So yes. So for the slide, you can kind of see, based on the look here, that it kind of talks about a little bit of the pieces that we have. So there's different pieces that need to be reported so that we can see that these milestones are being met, and we'll kind of go through how that reporting goes as well. You can see down kind of in the bottom left corner, there's kind of the interval, the suggested interval for the different ASQs, talking about the minimum to be eligible for different age brackets. So we have 0 to 24, 25 to 48, and then 49 to 60. Seeing that at the beginning, there's kind of a more higher frequency of them being done, depending on the, frequency of that. And then as we kind of go up, there's a little bit less frequency as we get closer to age 5. So we have also right above that is the two pieces that we talked about in Exhibit E. And then to the right is just a discussion of the data collected as defined from the standard data collection fields documents, which you guys already have a piece of. Just as an FYI, there is going to be some updates to that, and I'm trying to get that out a little bit after this is done. When it comes to the updates are mostly related to the milestone payments. So we'll kind of talk about that as we go through the data template as well. So with this as well, there's certain intake fields that we're looking to have you guys put down, specifically related. So intake / the demographic fields. So the 3 different files that we're asking to submit. So intake, referrals, and services. So intake, demographics, referrals, and services. So there's different pieces that we're asking that you guys try to submit to make sure that we're getting that information and that we can go through and accurately record that, yes, you guys are eligible for these milestone payments, and what pieces and data pieces. We'll kind of go through that as well. But in here, it's talked about we need the child's date of birth. So in that intake and demographic field, so we need that information when you submit. We didn't know what the encounter date was. So what home visit or healthy development piece was being, what that date was, what the ASQ was taken, and then if there was some sort of developmental concern identified. So that's particularly for ASQs. There's other requirements as aligned in the Exhibit E that relate to other specific milestone payments, and we can go through that. And if there's any questions on those, we can also try to answer those as they come up. But assuming that you guys submit all the data that you have on those pieces, then you should be fine in terms of how we set up those payments, and then just kind of going through about specifically with ASQs in this case is the interval piece. So if we go to the next slide, we can kind of start getting into the data template, and I can kind of start getting into the example that we have set up, particularly when it relates to this ASQ work. All right. So here we kind of have an example piece, and I'll get into how this looks when we actually get to the reporting side. So for the example that we had up there, we had an individual, a child by the name of Michael Jones. And Heather, if you scroll down, you'll see it in the demographic profiles. Should be the highlighted piece. Tried to make sure that I added this, and this will be updated and added to the original template that I set up. So we have this individual, Michael Jones, this child. We have their birthday in there as 3/20/2017. So this is just the demographic profile. So when I put together this sheet originally, this is not something that you guys would be submitting to the county, but this is just gives you an idea of what the individual looks like. I've added some other pieces that weren't included in the original slides just to kind of give the example more of the piece that we have. So the demographic profile is right there. And so Heather, if you want to move over to the actual demographics piece, then we can kind of talk about what that looks like in terms of submission. So we talked about in the intake field, specifically what we needed was the date of birth. So that line right there that's highlighted, it has all the information kind of as you guys have seen before. We have a record ID, we have the name of the child, we have the specific date of birth that we're looking at, the different pieces of addresses, primary caregivers information. One of the new fields that I want to talk about specifically, it doesn't relate to this particular milestone as much, but is a piece that we're trying to go to when it comes to talking about the different pieces for adequate prenatal care and preterm reduction of preterm births. So specifically those milestones when it comes to the healthy development home visiting group or prenatal work. So we're looking to try to track enrollment in WIC. So there's going to be a new code that's going to be a new field, variable, and code that's going to be put out. It doesn't have to be done for everybody, but it is another thing that we're looking to track if you're doing any prenatal care work for the long term. So for those particular milestones, then we and the outcome of preterm birth in the second year, that gets tracked for that work for home visiting and healthy development. And then so the other pieces as well are just the different codes. If you scroll right, Heather, just the different codes that we're looking at for you guys have seen and just kind of how it's been described in the standard data collection fields and the other technical documents. So I wanted to make sure that I included those as well. So the next piece that we want to look at is kind of the service profiles piece, because there was no referrals in the original PowerPoint for this one. It was just focused on particularly the ASQ screenings. But I will touch on just referrals because I didn't get to talk about it. I didn't talk about it in the previous slide. But when it comes to the referrals, we want to make sure as well that for any of those referral milestones that we have in there, so I believe there's one for one or two for home visiting and healthy development, and then another one for healthy and safe homes. So we want to make sure that those referrals are successful. So we want to double check that we are following up with those referrals and seeing that they were either successfully completed or not completed. So we talked a little bit about that in the individual data meetings that we all had, but I just want to reiterate that piece. And so that we're double checking that and inputting the data about that. And we can talk more about that if there's any questions, but I just wanted to re-highlight that. But when it comes to the particular services that we have for this individual, we have multiple different ASQs that were taken in conjunction to the home visits being done. So in this example, I kind of added some other pieces. So we're just saying that there's a hypothetical group. So the county health department is doing home visiting services, and their service unit with services completed. They had the first kind of initial contact with this individual on 5/15/2020, and then there was multiple other home visits that were done, and during those home visits, there was multiple ASQ screenings done. So there was one ASQ SE2 done, that was done on 8/20/2020, and then there was multiple other ASQ3s done on 5/29, 7/25, 11/18, and 12/10. And I also want to reiterate this as well because it's a little bit different than how you would normally submit. So you normally wouldn't have all of these dates on one singular monthly file because it'd just be that month of what those services were done. But this is just for the example purposes, I have them all included. So these would be split up based on the normal data submission timelines of having it done by the 15th and getting that submitted to the county. But for this example, they're all together just so you can kind of see the reporting of the individual pieces. So if we go into the services piece again, which is the actual file that you'll be submitting, obviously this one has more dates than you normally would because it's just across different months. So once we get into services, so we'll scroll back over a little bit. So we see here that we have kind of I believe it was 6 total home visits that we had. So we have the initial intake one, which there was no ASQ done. So that would be just reported for the our home visiting providers as a home visit as the kind of new intake of that individual. So we see the different pieces of their service unit. We see their encounter contact type under the one where there's 1 and then multiple 3s, and the other piece of information, but there's no, in those 2 columns, there's a blank right where there's pieces about the ASQ and if there was some sort of developmental concern identified from that. And then other pieces as well, you can see that there was the depression concern data field. Those are all 99s because this particular provider doesn't do a depression screening for the ASQ, not for ASQ, sorry, for their home visits. So then we see the other ASQs as they're taken. They're coded in as the individual ASQ, so either ASQ3 or ASQ SE2. And then if there's any sort of developmental concern identified from those, I added those just to kind of give you guys the flavors of the different ones that are possible. So particularly there was a couple that there was none identified on those. There was one where maybe there was a communication issue identified, and then another one for the social emotional one where there seemed to be a social emotional problem. And those might turn into different referrals that would happen for our home visiting providers, which could in turn be an opportunity for another milestone payment with that referral out for those early intervention services, by making sure that we're double checking those. So that's kind of the reporting piece. So that'll just kind of weave in to the normal monthly data feeds that you guys are sending. So when it comes to reporting the milestones, we kind of already put them in there. So if we go back to the slides real quick.
Hey, Tyler, did we lose you?
No, I'm still here. Sorry.
Oh.
I think my screen might be lagging a little bit. That's probably why. So in terms of just kind of seeing how this works, we see that we have those different home visits where there was the ASQ screenings completed. So we see that this individual is also age 3 approximately during these kind of home visiting times. And so they would fall into that second categorization, or second, I guess it would be the third and the fourth categorization, depending on the ASQ that they're taking. So in particular, we have so it would be the 25 to 48 months piece. So we have ASQ3. So the recommended frequency of those screenings is 1 per 6 months. So every 6 months you'd have one, and then if you have kind of more than that, then you might not be getting paid for that. But that's just kind of to say, hey, we want to try to get ASQ screens done, but we don't want to kind of overdo it if we don't have to. So there's ASQ3, and then there's ASQ SE2. So those both are 1 per 6 months. So there's a possible total for the payment to be for 2 for every year. So we can see that there was 5 done total, but the ones that are applicable that'll be that will probably be paid for would be the May 29th date, the August 28th date, and then the December 10th date, because the 29th was the first ASQ3, and then we waited 6 months, and then there was a new ASQ done on the December 10th. There was a couple other done, but those might not be applicable for the payments. And then the ASQ SE2 was also done in that time frame, but it was only done once. So we want to try to make sure that we're kind of keeping close to that frequency. This is particularly for ASQs. There's other payments that might also have frequencies, and we can talk more about that as well. And we'll answer questions as we go, but I think we are on to the next slide. All right. Okay, so just again, kind of reiterating, double check your Exhibit E, make sure that you're kind of meeting all of the guidelines that are set forth within that. And then when it comes to the data reporting piece, essentially just report it with your monthly data feeds as you normally would. So just as you're doing home visits, as you're doing healthy and safe home visits, or whatever work you're doing with your service units. So as you're reporting the work that you're doing with the individual children, just report on it, and you'll be good as long as you kind of try to follow those guidelines set up in Exhibit E. And then once you get through all that data pieces, we'll kind of work through that with the invoicing piece on the quarter. So hopefully having everything set up by those end of quarter dates. So we see those kind of reporting dates, but it's really just report the monthly data. And then once we get to the invoicing piece, you'll kind of understand how that kind of works with, we'll have the invoice, we'll have the data, and then we'll kind of use that to reconcile, make sure that everything is looking good, and then we'll get you guys the money for the milestone payments. So with that, I think that my piece is done. If there's any questions, we'll answer them at the end. But I think that we can kick it over to Kati to really talk more about how the invoicing process is going to work with the data process. So, Kati.
Yes, hi. So invoicing for milestone payments will be on a separate form. There will be one form specific to each agency, and I will send it to each agency by next week, April 15th. And you can see on the right side the deadlines for submitting invoices, but the schedule is also included in Exhibit E. And also, First Step Scan has put together a document for all 2020 dates to submit invoices and data. So I will go to the next slide. There is an example for the milestone invoice form here. It's pretty straightforward. You have to input the information by quarter. The first quarter this year will be from March to June, and then we'll go to the normal quarter months going forward. So the first column is the service program, which in this example is for healthy homes. The second column has a description of each metric achievement. And next to it, you will have to enter the total amount of metrics achieved for that particular quarter. And that will calculate the total amount to be reimbursed by multiplying it for the fixed unit price that was established for each metric. Then on the right side of the form, you'll need to enter the record ID number related to that milestone for each individual. So we can check and match the data with the invoices later on. So in this example, we have a total amount of $40 reimbursement for the first quarter. And then at the bottom, you can see the total year-to-date reimbursement and also the total remaining balance, which is calculated by subtracting the 2% of the milestone metric amount for each agency minus the year-to-date reimbursement. So yeah, pretty straightforward. Let me know if you have any questions. And like I said before, I will email this form to each individual agency by next week. So we go to the next slide. This is just a summary of the invoice process. First, the service provider completes the qualified activity defined by milestone metric, and then service providers will submit to First Step Scans the required data, and then the milestone invoice. And after that, First Step Scan will validate the data, and we will send the milestone payments along with the monthly invoice to Kent County for reimbursement. And once we receive reimbursement from the county, we pay service providers. So you will receive 2 payments that month. The first one for your monthly unit rate reimbursement, and then we follow the milestone payment. So that's it.
Thank you, Kati.
Yep.
Okay, well, we will continue on, and we alluded a little bit in the beginning to the year 2. And in our next slide, we have a brief description about the year 2, the year 1, what it looks like today, which is the year 1, and then the year 2 options. And we will reintroduce our social finance team to jump in and give an overview here.
Thanks, Heather. This is Danielle again. So this last slide, we just wanted to provide an overview, visual overview of the different options in year 2. But just as a reminder, in year 1, these numbers are placeholders, but each provider would have the opportunity to be reimbursed monthly for their fee-for-service amount, and then earn additional upside in milestone payments on those milestone metrics. So if you're a home visiting provider, those milestone metrics are things like the developmental screening metric. And then in year 2, you either have the option of the 2% milestones incentive, which is that left column there that looks just the same as year 1. So you have the option of that, or the 5% outcomes incentive, where you are earning your fee-for-service amount at 97%, and then have the opportunity to earn additional upside at a 3% rate in milestone payments, again on those milestone metrics, things like the developmental screening metric, as well as an additional 5% in those fee-for-service billings for the outcomes payments for outcomes metrics, so things like positive parenting practice or averted preterm births. So year 1 looks like the same first option for year 2, but year 2 gives you a little bit more flexibility in terms of which path you want to choose. I'll hand it back over to Heather to anything else here, or move on to Q&A.
Thanks, Danielle. Again, we just kind of wanted to put this out there as a reminder. We will have similar presentations like this that will really delve into this more in depth and get more into the details and give you the opportunity to think through this piece and ask questions. So stay tuned. In the meantime, this concludes the information that we have to present as of today. And we would like to open it up for questions for the remainder of the time. We are going to try to unmute everybody's lines. We'll just have folks kind of jump in with questions. Okay. Okay.
Hi, this is, oh, did somebody else want to start asking a question?
No.
Okay, sorry. This is Alex Markham from Healthy Homes. Coalition. I did see on the flow chart you had for the where the data is sent and then you verify and then the milestone payments come through. It did say on there, I just want for clarification, it did say that the data is sent to First Steps Kent. What we had before, yes, perfect. Yeah, that second one right there. We had that it's going to the Kent County Health Department. I just want to verify that process.
Yes, I'll answer that real quick. Yes, all data is going to be going to the Kent County Health Department. Apologies, we'll make sure to get that cleared up. So please do not send any data to First Steps Kent or to me. So this is Tyler again. I will not open the data and it will not be submitted to the county. So please go through, the county will give you guys more information once we get kind of the data process set up. Once we get the data share agreements finalized, they're very close. Heather might have something to speak about that. But yeah, for now, just kind of have a holding pattern, try to keep collecting your data. And once we get the pieces set up for that, we will let you all know, and you'll have more information once that's done. But it will be sent to the Kent County Health Department. The Kent County Health Department will warehouse it. We at First Steps Kent will get the de-identified portions, and then we'll use that for the validation of these milestones and other data pieces. So.
Hi, this is Susan Chang from Arbor Circle. I'm on the line with the meeting and also from the phone because I could not get audio to work. I had a question regarding the ASQs. If there is no concern or delay identified at the time we do those, does that still give us credit for completion?
Yes, it does. So just having you have the ASQ completed does give you it gives you the option to get that milestone. It's just as a way that there needs to be a way to track it. So just make sure you put that the ASQ was done kind of in that format. One of the ones that I think a couple of the ones that I put in there in the data template, which I will be uploading, that to the Village portal, including a couple of the new or updated documents about data related to the milestone and outcome payments. So once that gets uploaded, you can kind of see there was a couple of them in there that there was no developmental concern identified, but they were put into there as the data pieces.
This is Heather. I want to just jump into and bring people's attention to one more piece of information that you should be looking for as you are reviewing the contracts and reviewing the details around this. We want to bring your attention to that, to the fact that there is a cap with these milestones as well. We wish that resources were fully available and never would be depleted, but it's kind of the reality of the world that we live in. So just to draw your attention to that piece and to make sure that you go into your contract and look around the funding details around that to make sure you understand what you're eligible for. Kati will include them on all of your individual or agency specific milestone reimbursement forms as well. So you will find them on that sheet as well. We'll give you guys a moment more in case there's additional questions. We can go back to the Excel spreadsheet if needed and answer questions there too, if needed. Okay. Well, please know that we're here. If you think of questions kind of as you start delving into things and looking through things, feel free to reach out, shoot us an email, or pick up the phone and call. We're happy to answer questions as they come up. Just a few additional pieces of information. We will be posting this information on the Ready by 5 millage portal. And we will be delving into the specific metrics at the next Quality Improvement Consortium meeting. Those dates are also on the millage portal, so we encourage everybody to go out there and make sure that you pull those dates down and add them to your calendar. Also, just a quick note about upcoming technical assistant webinars. We have one on April 15th, which is next week at 1:30 p.m. and highly encourage all service providers to attend this one. It is specifically about the data sharing agreements. We have a process and we have approved documents from the county that are ready to be rolled out. So we will be kind of talking everybody through the different types of documents that your agency might use, depending if you're covered or a non-covered entity. And we will be rolling out a notice as far as how data will be shared, and additional information about some of the consent language that will be required to go along with that as well. So we look forward to having you attend and be with us on April 15th. And again, we thank you for your time and thank you for all of the work and your partnership as we move forward with the Ready by 5 early childhood millage implementation. So with that, we're going to sign off and thank you, everybody.